Welcome everyone to our December guest speaker event. We'll get started in a few minutes. Please feel free to say hi in the comments.
All right, everybody, welcome Alliance Hosted members to our December guest speaker event. I'm Mansa, your Alliance Hosted Secretary, and this is Mrs. Gina DeCruz, our December guest speaker. We are so excited to have everyone meet her and ask her questions in the second half of the event. So just as a reminder, we're gonna have a QR code for attendance at the very end, so be sure to stay the whole time.
Good evening. I'm Sonia. Just to introduce myself, I'm a sophomore council member and I assist the secretary. And I'm so excited to be here with all of you tonight to learn more about this healthcare profession.
So before we begin, I'd like to briefly introduce our CTSO organization to any of our new members. So HOSA is a student-led healthcare organization that strives to prepare students to be the future of healthcare. So through Alliance Academy's HOSA chapter, we bring to you these monthly guest speakers with a wide range of specialties and from all around the globe. So now, without further ado, let's meet our guest speaker. Tonight's guest speaker is Ms. Gina, and on behalf of Alliance HOSA, we welcome you with nothing but open arms. Thank you so much for joining us. We are truly honored. She's going to be presenting a slideshow to us for the first half of tonight, and then we'll be open for a Q&A discussion, so save your questions to the end. So that means the floor is open for any questions throughout the session, but we'll get to them around 30 minutes. So let's learn about Mr. Cruz. The floor is yours.
Thank you, Madison. Thank you, Sonia. And good evening, everyone. I'm just going to try and share my... I think you probably need to broadcast it, Arishi or Sonia, if you can help me with that. But good evening, everyone. Thanks for joining today. I am told that today was your last day of midterms. So extra props to all of you who joined today, because if it was me, I probably would be, relaxing in front of my TV watching Netflix. So thank you so much for joining today. And I hope I can make it worthwhile your time. I'm going to speak a little bit about my public health journey, and then kind of take questions from you, like Manasa said. I still cannot, let me try once more. Okay, I'm going to try sharing one more time and see whether we can get it going. Sorry. Okay, I'm sharing from my... Okay, I see what you're saying. Okay, let's do that. Okay, can you guys see it? All right.
Yes, we can see it. Thank you.
Oops. Okay, so let's get started. So as Manasa mentioned, I'm a health scientist with the Centers for Disease Control. But I want to kind of state it up front. I am not representing any CDC views or opinions or findings or results. It's purely sharing my personal career journey here. And I will not be answering any questions related to COVID or any CDC positions during the course of this presentation and during the Q&A. On that note, let's get started. I have 3 key takeaways for you. So if you don't remember anything else from this presentation, I hope you remember just those 3 at the end of this presentation. So my 3 takeaways are, I'm a public health professional, and you have been meeting different kind of healthcare professionals throughout these monthly sessions. So public health is a lifelong learning process. So you keep learning. There's not a point where you earn a degree and you kind of stop, because you need to update yourself regularly. Like you see, COVID is something new, which we learned about in 2020. So you have to be on the know all the time. So it's a lifelong learning process. And if you are a nerd like me, I call myself a perpetual learner. So if you're somebody like me who is interested in knowing things, this is the perfect profession for you, because you would have to keep yourself updated all the time. The second key takeaway is it's a very multidisciplinary profession. And when I walk through my career journey, you will kind of get a glimpse of that. But not just me, but my colleagues, as well as others who work in this profession, come from a very interdisciplinary background. We have doctors, dentists, nurses, vets, occupational therapists, or behavioral scientists like me, epidemiologists. So it's a very multidisciplinary profession, and you require a lot of collaboration across different disciplinary areas to succeed. The third thing is, you may not know it, it's very cool and sexy to work in public health, and it's also super critical, as you might have seen. And I'll explain that a little bit in the course of a presentation, because when public health works, nobody really notices it because it's called one of those invisible professions. When it's working, nobody notices anything amiss. But when it starts breaking down, like you saw during the COVID pandemic, things start getting awry, and you will notice when public health systems break down or the public health mechanism fails. So these are the three key takeaways I hope you would take away from this presentation. So on that note, I want to give you an overview of where I started and where I am right now. And during the first couple of minutes during the slide presentation, what I'm hoping to emphasize is one, the three key points that I made earlier, that how it is multidisciplinary, and kind of illustrate using my background why I said that. And the second thing I also wanted to kind of emphasize is the lifelong learning aspect, and why I said that in terms of from where I started, from where I am now, you would see a wide range of different disciplinary areas that I had to learn, and hope that gives you a glimpse of why I mentioned that it's a lifelong learning process. So let me start with the beginning. I'm not going to go into the high school phase, even though it's super important. And I know you guys are in the health stream. And to be honest, I grew up in India, and till my 12th, which is the senior year equivalent here, we didn't quite have sort of the track system that you would have here, or at least in your school. I ended up taking something that would either let me apply for the engineering specialization, or the pre-med equivalent of what we have in the US. So basically, I took a lot of bio courses, math, and physics and chem. And I wanted to apply for medicine only because my parents wanted it. And then I realized once I got in, I really didn't want to go through that route. So what I ended up doing was pick something that would get me expertise in wide variety of three disciplinary areas, which was psychology, economics, and sociology, because I was confused at that point. So that's why I did my undergrad in those three disciplines. And during that time, I was also working part-time with a clinic that would support kids who had developmental disorders. And I used to work as a clinician's assistant there. And because of that experience, I got more interested in knowing more about psychology in general, and I wanted to get more applied experience in it. And that is why how I ended up doing a master's in medical and psychiatric social work in one of the premier institutes in India. It was a very tough entrance to get in, and it's one of the very few places that offered that particular course at that point of time. So that's how I ended up doing my master's in medical and psychiatric social work. And I did end up working for a year and a half as a therapist, meaning doing like hardcore counseling with a clinic that kind of dealt with patients who had bipolar disorder, schizophrenia, and so on, like the hardcore clinical psychology manifestations. But at that point, I realized this is not something which I wanted to do in the long term for very personal reasons, because I wanted to focus more on the population health, or the larger community level rather than the individual level. So when you are focusing on clinical psychology, it's more sort of the individual person to person care, versus I wanted to kind of expand that spectrum and get into more public health and population health. So at that point, I could diversify, and I started working with UNICEF and a couple of nonprofits in India at that point, who focused on maternal and child health and microfinancing and education in different parts of South Asia. So I worked as a consultant, as an international development consultant, for about 2 years. And in that role, I kind of got to travel across India and a couple of places in South Asia, doing monitoring and evaluation of several maternal and child health projects, where you would fund these projects to support different types of maternal and child health outreach projects, or microfinancing, for example, like self-financing for women's empowerment groups, like if they're making handicrafts, that we would supply the funding for that so that they can stand up their own units. And we will be sent out as the monitoring and evaluation folks who would evaluate how it's going, whether to continue the funding, and so on. So I was working with a couple of the funding agencies at that point, and one of the ones which I'm sorry, somebody's trying to call me right now. Excuse me. So I was working with the UNICEF at that point, and they actually sent us out to the northeastern part of India, to a state called Assam. And the project which we were assigned to basically was to work with the riverboat intervention. And that kind of changed my life. And I'll get into that in the next two slides. But that's the experience that kind of made me want to get into public health, because I kind of understood the significance and how critical a public health infrastructure is, along with education and income generation, because those three were my core domain areas until that point. But that experience kind of honed in the importance of public health and why we need more people in that. And at that point, unfortunately, India didn't have a lot of good universities or courses that offered public health in general. And I didn't think that I would get any additional training other than what I got during the course of my master's. So I wanted to kind of pursue the degree outside. That's how I ended up doing my PhD in public health from the University of Texas Health Science Center. And my specialization was in behavioral sciences. So behavioral sciences is basically looking at human behavior that would promote or affect public health in general. And I also had the opportunity to specialize in maternal and child health and biostatistics and informatics. And the word informatics will come into play right next to the next journey which I undertook. So I was completing my PhD, and I was almost close to my dissertation stage, and I was working in different projects because I always wanted to kind of merge public health and technology. So I was intentionally seeking out these projects that would help me do that. So I ended up working with this group that would make computer games for adolescent sexual health education. I also worked with this group that was working with the universities in South America that was doing telemedicine. So I ended up going to Brazil and working with a couple of universities there, helping them stand up their telemedicine units for their social and psychological medicine referrals and things like that. So I was working in that field, but I knew that I wanted to kind of get more training or applied experience in it because I liked doing that kind of work. But at the same time, I was doing PhD in behavioral sciences. So that meant I could either go in the academic route where I could become like a professor or assistant professor or faculty somewhere, or I could go into sort of the healthcare hospital systems or into consulting. But I didn't want to do any of these, and I was kind of confused. So one day I was just sitting there and Googling public health and technology, and then I chanced upon this website, the CDC website, which had the fellowships and training opportunities that's available. And it had this fellowship opportunity that was opening up right away. And this is something which I believe in. Sometimes, you know how people say being at the right place at the right time, but I kind of want to add the caveat, right place at the right time, but with the right effort as well. So I ended up applying to this fellowship, even though I didn't qualify for any of the eligibility criteria that was listed in the website. They wanted people who had completed a PhD, and I was still completing my PhD just with my dissertation phase on. So that means I was not really eligible, but I was like, okay, let me give it a shot because this sounds perfect for me. So I ended up applying. And for some reason, what happened was they had an exact project that was looking for the very specific skill set that I had at that point of time. Like I mentioned, I was working with the university team that was making computer games. So the CDC folks were looking for somebody who had experience in gamification and also behavioral sciences, which was sort of what I was doing. So there was this opportunity that was sort of like tailor fit for me. I ended up getting it. So I did this 2-year applied fellowship experience with the CDC, and I'm happy to answer any questions about it, if you have questions about it during the Q&A stage. And I ended up staying at the CDC. They hired me as a health scientist in with the specialty informatics, because that's the fellowship which I did. And in that role, I have been doing different things, and I'm happy to talk more about it as well, if you're interested in knowing more. But currently, I work as a lead health scientist at the CDC in different capacities. And right now, I'm with the Center for Chronic Health and Health Promotion. And right before this, I was with the same division that hired me as a fellow. So it was kind of life comes full circle. And I really love my work. It's very different. Every day is different, and there are new challenges and opportunities that comes every day. So that's my journey in a nutshell. Now, coming back to the three key takeaways, and the reason why I said public health is a lifelong learning process and it's a multidisciplinary endeavor. Let's go back to the experience which I mentioned earlier, the one at Assam, where I worked in these river islands. So these river islands are basically very socially and geographically excluded place. So what happens is they're located in the middle of one of the largest rivers in India. It's called the Brahmaputra River, if you're familiar with that geographical region. Every year, when it rains, it floods. And these geographical islands kind of get displaced every single year. So what that means is these people who live in these islands loses their homes, loses their possessions, and they kind of migrate to the mainland for a couple of months, and then they have to go back. So, because of this reason, they don't exist in any maps, they don't exist in census, they don't exist in the government records. Because they don't exist, they don't get any governmental services such as education or health, and things like that. And when I say islands and they're getting displaced, it's not just a couple of thousands of people. There are multiple river islands like these, and there are millions of people who get displaced every single year because when these rains happens. So I worked with a nonprofit that provided healthcare and education services to them during these flood times, as well as during when they get displaced and they are migrating to the mainland. So we ended up, so this is the boat intervention. They had multiple boats like this is the particular boat which we used to stay. And you can see my colleagues there as well. So these boats would take anywhere between 2 to 3 days to reach any of these river islands located in this river. And the boat had a doctor, 2 nurses, and a medical assistant. It also had a mobile surgical operation unit so that in case there are surgeries that can be done in that sterile environment, they had facilities for that. And we also carried like medical supplies like vaccines and things like that because they cannot come to the mainland. It would take about 2 to 3 days to travel with the kids, or like if they're pregnant mothers, to travel to the mainland was such a hurdle. So it's during this journey I realized how privileged my specific life was. And even though I was working with underprivileged communities, or primarily in the urban area across India, this experience kind of molded, how you say you had an epiphany, like the Buddha under the banyan tree moment kind of thing. I wanted to kind of change and make change that would help communities, and also underprivileged communities specifically, especially marginalized mothers and children who needed healthcare services. And I realized public health is the way to go. And that's how I kind of ended up in the public health discipline. And the people you see in the picture, they all came from different backgrounds. One was a statistician, so he had a statistics background. Another did public health. The other one came from a public policy background. And all of us, and I came from a social work background. So all of us actually worked towards a public health project, and we each had distinct skill sets which we offered that came to the success of this project. And I'm happy to talk more about this as well. In the interest of time, I'm going to move on. This is probably the moment that made me think about the life choices that I'd made until then and move towards public health. And I really hope each one of you kind of get the opportunity to have that level of conviction about something that you're passionate about to pursue your career. And I really wish you that, because that really does make a difference and makes you passionate about things that you would choose to pursue. So let's do this. If you have your phones or your computer, you just have to go to this www.menti.com and use the code 82429613 when prompted, because I just want to I'm just curious to know what public health means to you. And I'll share my screen again so you can see the results. Okay. Okay, I'll give it a minute more because I see one person typing. And you can put in multiple responses. It doesn't have to be one word. That is great. Okay, so I see a couple of words that's coming up. Outbreaks, that's pretty much obvious that we think about outbreaks and epidemics and pandemics in the past 2 years. Caring, that's great. Protection, monitoring, accessible, inclusive, well-being, safety, health, disease. I'm very impressed. So I guess I can stop here because you all already get it. All right, this is great. And I like the fact that how caring is in the center and pulled it out. Demography, inclusive, policy, that's very important, because if you don't translate anything to the research into policy, we don't get anything done, because public health is often underfunded. And if we cannot translate that findings into policy, none of this would matter really. This is great. So thank you for doing that. And the reason I was doing it is because everybody has a different perception about what public health is. Some people think it's just diseases. Some people think it's just a couple of disciplinary areas like epidemiology or statistics and so on. And I want to kind of emphasize that it's an ever evolving field. Like I said, it's lifelong learning. And all of these factors and more contribute towards public health. So I'm going to go back to our original slide deck. And let's see if I can share again. Sorry. Okay. Can you guys see it? Okay, awesome. So I want to kind of emphasize that, like I mentioned earlier, public health is often called the invisible profession because when it's working, we don't quite notice it. So if you enjoy clean air, that's actually part of public health, because industrial pollution, making sure that the pollution levels are under control, is a public health function. Your local public health department and the state public health department is responsible for that. There are federal laws that mandate clean air and so on. If you think you have good walkable walkways and parks and recreation centers, that's actually public health, to make sure that obesity levels, or especially childhood obesity levels, or you know things that would contribute towards lifestyle diseases, keeping that in control, and doing health promotion is actually part of public health. Occupational health, the chair you're sitting, when you're going to work, when you're working in hospitals, are you wearing PPE? That's a public health function. And then the obvious, the infectious diseases with the COVID and other infectious diseases like flu, vaccines, all of them comes under the gamut of public health. Again, lifestyle diseases like blood pressure, stroke, diabetes, all these also come under the purview of public health. So, to put it simply, anything that keeps you alive and promotes the quality of life, that would fall under the umbrella of public health. So the impact and the reach of public health, regardless of which field you are in, is actually very large. And that's something which I would like you to kind of ponder over if you're ever thinking of getting into public health. The impact that you would have with even one intervention that you had worked on is really going to be super, super large, because it would touch a large community's health in some way or the other. And this is something which came in this. I'm getting into slightly technical and nerdy area. All I want you to kind of focus on is this is something which came out 2 years back, and it's called the Public Health 3.0. It's kind of the vision that the federal agencies proposed as the three buckets of prevention. So it kind of shows you how, from clinical healthcare, which is the typical professions that you are probably aware of, like clinical medicine or dentistry or veterinary medicine, nursing, and so on, how from that healthcare, which is service-based care, how can we move from there to a more population level impact? So you cannot kind of have these in silos, and that's what's happening. There's clinical care, and then there's public health somewhere in the corner, always underfunded, trying to make an impact at the population level, but that's not going to work. So there should be an integration between healthcare and providing services outside the clinical setting. So that would be like your WISE, the YMCA offering, exercise or physical activity, or children's recreational activities, and so on. And then moving into larger interventions like the stroke prevention one, like the Million Hearts, or your public health department doing some sort of intervention and outreach. So these three buckets of prevention needs to come together for impacting wholesome health in our community. So that's the whole concept. And the area where I focuses on primarily now, which is informatics, is basically this. Let me come back to that slide. Basically, this concept of getting the right data at the right time to the right people for right public health decision making. And that might sound a little simplistic, but it's not easy as it sounds. If you don't have the right data to make right decisions, you may not be able to make right decisions. So that's why I mentioned it's not just enough to do research. You need the research data to be translated to policy and to get to the right people to make or create that policy, which is our policy makers. So I basically focuses on this piece of it, and that means a lot of different things. So one day I might be doing data analysis, another day I might be reporting out that data, another day I might be building systems that would help report out this data, like a COVID data dashboard. Another day I might be training people to kind of build the dashboards or build data pipelines and so on. So there's a wide gamut of things that I would do on a day-to-day basis. And it also boils down to this concept. In US, 97 cents of every health dollar goes to medical care, which is like clinical services. And that's super important. But only 3 cents goes to public health, which is the more population level umbrella. And with COVID, things are changing. There's a lot of injection of, I guess, policymakers as well as the general public are getting more aware of why public health and at a population level is more important, and why we need good systems in place to kind of respond to pandemics and emerging threats, including infectious and non-infectious diseases. So again, I deal with the whole the reason I kind of showed this is because this is what I learned during the course of my fellowship at CDC. So from my PhD in public health, which focused on behavioral sciences, I moved to this discipline where it intersected between the public health domain and sort of what we call now data science. And I'm assuming that you guys are familiar with the concepts of data science and statistics and math and so on. So there is this huge movement towards how public health intersects with data science and how it is really needed to get to this concept of getting the right data at the right time to the right people for right public health decision making. Because I'm assuming every single day, at least during 2020 or at least during some parts of 2021, we all turn to like the Johns Hopkins COVID dashboard or the CDC COVID data tracker or your public health counties COVID tracker and so on. So this is the domain or the space I kind of work right now on. And within this, right now, my expertise area is in more sort of the data visualization space. And also I train in my last role, I used to train folks in applied epidemiology and public health informatics. And in my new role, I would be working specifically with the chronic health conditions and trying to set up systems and data pipelines that would help us get to this goal. So on that note, I also want to kind of show you two quick nerdy things, and feel free to type in your comments in the comment box. If anybody recognizes what you see in here, go ahead and type it in the comment box. And I see questions there already. That's great. Okay, in the interest of time, I'm just gonna go ahead and ask, have you heard of Florence Nightingale? And if you have heard of her, what do you know about her, basically? Okay. I don't see any comments. Maybe I'm not. Okay, I'll go ahead and say this because it's my nerdy thing, and you may not be necessarily interested. So Florence Nightingale is probably well known in history as a nurse, and she's one of the icons in the nursing profession. And she's more well known for that aspect of it. But many people don't really realize that she was also a statistician and a data visualization expert. So what you see in this screen is basically a handwritten visualization sheet that she did during the course of the Crimean War, basically showing that everybody thought that these soldiers were dying because of war wounds. Her graph basically shows that they were not dying of war wounds, but more sort of infectious diseases like cholera and dysentery that they caught within these camps where they're getting these soldiers to stay in because of unsanitary and unhygienic conditions. So the black expansions which you see are the causes of death that's caused by those unsanitary, unhygienic conditions. And the ones you see in that reddish tinge is basically war wounds. And this data visualization, or this graph, basically illustrated that that's not the main reason that the soldiers were dying. Similarly, this is another very famous graph. This is the Jon Snow water pump graph. So if you get into public health, this is like one of the basic 101 lessons that you would gain, like in epidemiology. So everybody was confused about this cholera outbreak that was happening in London in the mid 1800s, and everybody thought very different reasons. They thought it's gastrointestinal, they thought it's spread by air, but basically Jon Snow demonstrated that it is waterborne, and it was concentrated around this water pump that was located around where people were getting infected, and where people were living who were these patients. And you'll see the modern day examples in the COVID data tracking or contact tracing and vaccine tracking and so on. But what I want to emphasize is public health has a lot of pathways. So it's not just epidemiology, it's not just statistics, it's not just infectious disease. It can be a wide range of different things, and that's what I love most about it. And you can be a communicator, you can be an artist who visualizes the coronavirus. The person who illustrated that was in the news the other day because everybody uses that illustration. You could be a behavior scientist like me who also can venture into other fields like data science, where you kind of merge two different, completely different disciplines, but to make an impact in public health. So it is a lot of different things, different types of things. And it's not, the main thing is it's not individual level, it's more of a population level impact. And you get to do things every single day that would be affecting multiple people's lives, and sometimes even a country's public health profile. So that's why I love being in public health. And I think somebody asked that question. And let me pause there because I know we have probably now 15 minutes to take questions because I took more time. So these are the three key takeaways again, and I will pause there and take questions.
Awesome. Thank you so much, Mr. Cruz, for that wonderful presentation with so much valuable information. We really loved learning more about public health and your journey throughout the healthcare field. So we're going to open up the floor and start up the chat box for any questions. I'll go ahead and start up our Q&A session. So do you have any sort of recommendation for high schoolers who want to pursue being a health scientist in the future?
That's a great question. And CDC, in fact, has a lot of programs that's open to high school level students. So there's the CDC Museum Fellowship. And off the top of my head, I don't have the information, but I'm happy to kind of send the links to you. We also have a program which is called the Science Ambassador Fellowship, which is open for high school teachers who are interested in promoting epidemiology and public health in their classroom. So if any of your teachers are interested in that, I'm happy to share that information as well. But because you're all interested in the health professions, there are multiple training programs that's open at different levels. And if you go to cdc.gov/fellowships, you'll get the information from there. And again, I'm not speaking as a CDC representative, but because I've worked in that division and I have been a fellow myself and how I've benefited from those programs, I would highly recommend you checking it out if that's something which you are interested in.
Awesome. Thank you.
No problem.
So Mia asks, did you shadow anybody in this field before wanting to become a public health scientist?
That's a great question, Mia. I didn't, but I know of a lot of my colleagues who had somebody who was working in public health as a mentor when they were in high school or when they were doing their undergrad, and they highly recommend that experience as well. It is not a prerequisite that you have to, but it's always good to have some level of experience just so that you kind of get that flavor. Because, like I mentioned, I wanted to actually become like a clinical psychologist, but when I started practicing, I realized that's not for me. Conversely, you might want to become a public health scientist because of its appeal, obviously, but maybe once you start working, maybe you want to go to clinical medicine. So it's always a good idea to kind of shadow somebody. Absolutely.
I have a question.
Sure.
Um, did you always know you wanted to do this?
I always want, so one thing I was very clear when even since my high school days is I wanted to do something that made a difference in people's lives. So I was not really looking for something that was like necessarily high paying. Like I don't know. I definitely didn't want to be an investment banker if you know what I'm trying to say.
Right,
I wanted to be
right.
in like a service oriented profession,
Hmm.
and I wanted to do good every single day when I am there. So I also didn't want to like the typical 9 to 5, the same type of work kind of thing. So those were some of the things which I had very clear in my mind, and it just ended up so that I was able to check off all of those in my list.
Got it.
I don't know if that answers your question. Maybe.
Yeah, it did. Thank you.
Okay, another one of our members asks, what is your least and most favorite part about being in the public health field?
That's also a great question. I love your profile ID. Dancer forever. Um, so my least favorite part is that it's very underfunded. It's critically underfunded, so much so that it puts all our lives at risk when something like this happens. Like something as critical as a pandemic happens, because our public health systems are underfunded and overburdened. We're not able to respond as effectively as we could, and that's not just in the US. That's a case everywhere, in across the world. So that's my least favorite part about it. My most favorite part about being in public health is its reach, how much we touch people's lives every single day, by doing even the most simple thing that you're doing your day-to-day work. So the reach and impact of it is what I love most.
Did your specific career have a travel a lot?
That's a great question, Sakshi. So it really depends on what you want to do. So I have friends who are in CDC, there are multiple centers of global health. And even before coming to CDC, when I was in public health, there are opportunities where you get to kind of either go to different countries, or even within US, you can travel a lot. So it's up to you, actually. Depends on your interest, you can choose. Personally, I have a toddler at home, so I prefer to do minimize my travel at this point. But earlier, I used to travel a lot. Like, would be in different countries or different states within US, and even now during the COVID response. Actually, I have been deployed for almost all the responses since I joined CDC, like the Ebola, Zika, COVID. But you could also choose to deploy internally instead of having to go to an actual location. That means you actually work online, or at the Emergency Operations Center at CDC. So there are different choices, and that flexibility is also something which I like about the job. I hope that answers your questions, actually.
How do you balance all of this in your life?
To be brutally honest, I don't know whether I'm balancing everything. um,
Mm.
all I can say is, the last 2 years, I guess it was difficult and challenging for everybody, regardless of your profession. I'm sure
Right.
it was challenging for you all as well, to balance the online or the virtual environment and being in high school. I'm sure that was difficult. So I guess human beings in general, because of my interest in behavior science, we're very resilient lot. I think that's built into our DNA, and we kind of are able to kind of pick up and move on as long as we have a good support system and we have good work life balance. So I think that's very important to maintain that emotional and physical health well-being, and making sure that you dedicate time for that and not just get sucked into the whirlwind, is what I would say.
I think one of our members asked, what do you usually do when you travel outside of the country?
Oh, do you mean for work or do you mean for like generally for leisure?
I think she means for work, like
For
deployment.
work. Okay. So it really depends on your role. So I would say, in one of my previous roles, what we used to do is we used to provide technical assistance to different countries. So that would mean, talking with a lot of the people who are working at the country offices about the systems that they are using, their data flows, mapping it out, identifying what the gaps are, what their needs are, and the requirements and things and so forth, and helping them improve their reporting processes and so on. I have colleagues who get deployed to do emergency investigations on like a disease outbreak that country has, or there are folks who get deployed to support the operations of the country. So I have colleagues who are placed in country offices for 1 or 2 years, where they are there to actually support the operations of that country office. We also work with a lot of other agencies like WHO and other partners in different countries. And again, it really depends on what your specific role is. In my current role, I probably is not going to interface a lot internationally, but my most of the engagements probably would be within US with the state and local public health department. So it really depends on the role, actually.
Now, Dhruv asks, what is the coolest part of your job?
Oh, there's so many cool things through. I don't know. Um, I want to say no single day is the same, and it has its pros and cons. Because it's very unpredictable sometimes. You don't know what's coming, but it's always exciting. And I think that's what I like. It's always going to be a challenging day at work.
Okay, our last question. How do you see your job or role changing in the future?
Oh, I wish I had a crystal ball. I can actually tell you based on some of the current trends that we are seeing. It is multidisciplinary as is, but it's going to get a lot more multidisciplinary because during the pandemic, we have seen how the different partners, like the academia, the industry, everybody has kind of come together and putting in resources. So I see that kind of changing. We are also sort of moving towards more hybrid learning mechanisms. So earlier it used to be a lot of our training programs, you have to be there in person to do the investigations, or you have to be there in person to get trained, and that's kind of changing. That also means the scale and the scope of the training would also change. That means we can train a lot more people in public health, because earlier only people who can travel or can afford air travel and things like that can come to Atlanta or wherever the training is occurring. Now if we can change the scale and scope, that means anybody anywhere in the world can get trained on public health and epidemiology or informatics or public health data science. And that is revolutionary for a lot of countries who have very low and limited public health resources. So that's very exciting. And definitely this intersection of public health, data science, and predictive analytics in general, meaning how can we predict pandemics coming and predict a lot of different things like the economic trends and its impact on people's livelihood or impact on people's health. Those type of things are changing. There's also artificial intelligence and machine learning doing a lot of contribution towards public health. So there are a lot of changes that's happening. So based off of that, our roles will also be changing for sure. But that again, it all goes back to that lifelong learning. I think public health professionals are always at that we need to keep learning to survive kind of mode. So that's actually helpful.
Excellent. Thank you so much, Ms. De Cruz, for your time. You've definitely inspired a lot of students and all of us to pursue medicine and healthcare. To close out our event, we would like to thank you all for joining us in this conversation and making it interactive.
Yeah, thank you so much for tonight. We really do appreciate you taking the time out of your day and just talking with our high school students, because we all aspire to be like you one day.
Thank you. And I hope our paths cross again. I'm pretty sure you guys are going to change healthcare and public health in the future. So I'm looking forward to it, and good luck with everything. Happy holidays, by the way.
Thank you. Happy holidays to you too.
Happy holidays.
Thank you. Get your vaccines and boosters if you haven't.
Yeah. So for our HOSA members, we're going to leave the QR code for attendance up for just another 30 seconds. Remember, to get the credit, you must complete the form before December 24th, this Friday. This video is going to be posted soon on our YouTube channel. Thank you guys and have a good night. Bye.
Thank you.
Bye-bye.
Thank you.